Okay, so we're going to talk about integration of imaging into your actual practice, no? At paano natin gagawin yon? Ano ba yung expect mo mangyayari? So, in this lecture, although short na lang siya and very simple, but you can expect the different things that can occur in your practice. Okay? So, tapos, ang maganda dito is that you know what could happen and then may guide tayo ano ang pwede mong gawin. Okay? So, keep that in mind while we're going through everything. Okay. So, let me just minimize this. Ayan. No? All right. So, nagkaroon ng change in perspectives on diagnostic imaging. The reason for that is kasi nga, di ba, pag PT, dati, at least the training before, di gaano. Di wala gaanong exposure on imaging in the educational curriculum. In fact, let me tell you na mukhang this is the first time na talagang in-enhance, no, yung imaging. Kumbaga parang nag-focus tayo sa imaging sa training ninyo. And kayo ang, let's say, I think, as I believe, kayo ang first na mag-benefit nito. So it's important siguro na you find out bakit ganon. Now, there are two models of education here. So you look at the traditional model, pag physical therapy kasi, more of ang exposure niyo sa imaging is kung ano lang yung nakikita niyo sa practice. You were not really trained for that. The reason is you are trained to be clinical rehab specialists. But then eventually you have to change, you have to improve. Okay? Kaya ngayon, kasi nga magiging primary care provider na kayo, kumbaga frontliner na rin, no? In reality, no? With even without the pandemic, pandemic climate, magiging frontliner na rin kayo talaga. So you're gonna have to be a standalone clinician. Lalo na kung may imaging kayo, dapat alam niyo anong gagawin. So that's why nagkaroon ng expertise na kailangan in musculoskeletal imaging. So ano nangyari, no? Kasama tayo dito. In response, yung professional education nagbago. Kasi dati nga, 'di ba, hindi masyado, let's say incidental na lang kung tinuruan kayo, no? Like yung CI nyo maybe uh, willing siya mag-share about imaging, edi napakaswerte nyo, 'di ba? Kasi hindi nga siya gano'n ka-focus dati. And then ano pang reason, no? Ang isip kasi nila hindi masyado ito nakakatulong sa daily practice. That was before. But if you ask really, maybe it's because of the increasing availability also. And syempre cheaper na ngayon magpa-imaging compared dati. Okay? Kasi maraming competing na modalities. So maybe it's also good na sagot din yung ibang modalities, no, ng PhilHealth and all that. So that's good. So it makes it all the more na dapat familiar kayo. And eto pa, no, the absence of diagnostic imaging subjects reflected the traditional model of medicine. Ibig sabihin lang nun, nakabase tuloy ito siya sa strict, very strict na physician, nagda-diagnose, and radiologist, and let's say super radiologic diagnosis, while ang physical therapist is ang expert sa clinical na nagka-carry out ng dapat na treatment. Okay? Depending on ano yung evaluation ninyo. So now we have the evolving model, which is, ano na, since kayo nga ay magkakaroon ng sabihin nating stand-alone na practice, no? In a way, kumbaga there's an increase in the independence, especially outside. Ang nangyayari is you have to have higher professional standards. Ibig sabihin, mas magaling na kayo dapat, mas mag-grow. So hindi nang limited ngayon yung scope ng physical therapy. So in fact, no, some of the laws sa US now allow, okay, kasi nga 'di ba yung libro natin ay US based naman. So they now allow na diretso ka na. Kasi not everything pero some states allow na diretso ka na as a patient or diretso yung pasyente sa iyo if you're a physical therapist. Okay? In fact, meron na nga doon no? Kasi mamaya na lang 'yon. Okay, so all the more since diretso na sila sa inyo as physical therapists and clinicians, all the more dapat pag may hawak-hawak silang imaging, gets nyo agad anong pwedeng gawin, anong implications doon, at higit sa lahat, no? Because good practice means a safe practice, alam nyo ano ang hindi dapat gawin. Okay, so ito yung sabi ko kanina, no? Merong Vision 2020 na sinasabi, but this may be delayed because of our current situation. So, Vision 2020 is about changing the identity of the physical therapy profession from the traditional into the new, modern, updated, evolving model. At higit sa lahat, no, magkakaroon din ng tinasabi nating Doctor of Physical Therapy degree. Now, Ang tanong naman ngayon is, meron bang doctor of physical therapy dito sa Pilipinas? Well, the answer is yes. So far, tatlo pa lang ang alam ko na meron. Okay? Tatlo pa lang. Sa labas, meron. Like you have sa US, no? And lalo na sa New York, no? I think that's a hotbed for physical therapists. Maraming nag-exam doon. Okay? So with that Vision 2020, ang goal nila is that talagang yung practice nyo will be so good and so independent na kayo in a way, especially no, kailangan din humabol ng mga batas natin, but you will be doctors of physical therapy. So napakaganda nung professional advancement na mangyayari dyan sa planong yan. Okay? So ano pa? It has the effect of encouraging physical therapists to take advantage of new technologies kasi nga, no? Ang other than nuclear medicine, napaka napakalaki ng benefit ng radiology when it comes to technology advancement. So dapat kayo rin magbe-benefit doon. Now, let's talk about you guys as an educated user of diagnostic imaging. Ibig sabihin, no, talagang may formal training kayo. But remember, you are part of an interdisciplinary healthcare team. Ibig sabihin, ano nga yung pinag-usapan natin last time? 'Di ba? That it is not really about competition. It's about you being able to collaborate with other members of the health team, the nurse, the rehab specialist, the radiologist, para sa benefit of the patient. So you also have to be aware that maraming parameters associated with diagnostic imaging. Pag-usapan natin yon, kasama na yung cost, availability, and radiation exposure and all that. Okay? So, pagsimulan natin. Ngayon, ano bang idea natin of the physical therapist as an educated user or educated na talagang may alam na clinician na with the idea of becoming independent, no? Kailangan magkaroon kayo ng ability na kaya niyong kaming kausapin mga physician about diagnostic imaging. Huwag kayong mahiya, bale. Huwag kayong mahiya. That is the goal, no? Na talagang sufficient and very familiar kayo sa technology na pag may nakita kayong image, you're willing to talk about that imaging result with confidence. Kasi ngayon, part na yan ng physical therapy na scope. Okay? Ano pa? Pag may nakita kayong kulang or let's say may questionable, no? Or sa radiology language pa, meron kayo nakitang artifact kasi hindi dapat yun nandun or maybe there's a fault in the imaging, then pwede mo sabihin siguro na mag-suggest ka, no? Na, uy, ang hinahanap naman natin, let's say, is soft tissue. Pero ang meron is X-ray. So pwede ba makita ang soft tissue sa X-ray or rather conventional radiography? Pwede naman. Pero you don't really see it as soft tissue per se. You see it as evidence of the soft tissue damage. Okay, parang you see the shadow. You don't really see the soft tissue kasi nga pag soft tissue, mas makikita siya sa CT pero lalo na kapag MRI. And of course, kung may ultrasound, mas maganda 'yon. Okay? Ano pa, pag nakita ka ng image, mas maganda kung kailangan mong mag-refer sa radiologist, edi kaya-kaya mo. Alam mo anong sabihin. Kasi kailangan din nila ng information. In fact, ang pinakareklamo, I'll tell you ha, ang pinakareklamo sa practice of radiology and pathology, no, yung mga doctor ng patay, doctor ng tissues, doctor ng mga crime scene, yung mga pathologists, no, lalo na pag nag-medical legal sila, is that they rarely have enough history. Sabihin nila, refer to radiology. Yun lang. Pero minsan, no, ang naiipit talaga yung fourth year medicine students, yung mga clerks, kasi sila pumupunta doon sa radiology department, hawak-hawak nila yung x-ray or yung referral, and then they will ask, the radiologist will ask, ba't mo ito nire-refer? Wala lang. No? Kailangan may history. So, just remember na pag nag-usap kayo with any other professional, since it's a referral, dapat may alam kayo sa pasyente. So, do not make our mistakes. Okay? Kaya minsan nagkakagulo between departments. Lalo na, ba't di mo sinabi na ito pala yung history niya? Di sana iba yung findings ko. Nangyayari na yon. Lalo na sa mga seminar, no? Or sa mga tumor boards na sinasabi. You have all the different specialties looking at the different case to find out kung worth it pa ba siyang i-surgery or mag-conservative lang. So I know that. Okay? So what's a practical reason na kailangan magaling kayo sa imaging or very, very, very familiar because wala namang monopoly of knowledge, no? We're always supposed to be in a pursuit of learning. It's that it's not really possible na every time may nakita ka, no, may tatawagan kang radiologist. Ako nga, hirap. no? Kasi busy sila and usually no, sabi nga 'di ba, sila yung mga doktor sa dilim, no? Kasi nagbabasa sila ng mga film sa dilim, it's usually in a dark room, computer lang. So, actually mahirap silang mahagilap kahit sa ospital. Okay? So, for those times, lalo na pag nasa bukid kayo or sa mga areas na nangangailangan talaga ng healthcare, tapos walang iba, then maybe kayo na lang ang dapat talagang mag-interpret ng imaging. Okay? Ano pa? Now, a physical therapist must have an awareness of the most appropriate diagnostic imaging. Fracture lang. Fracture lang. First line natin is always X-ray. Hindi ko minamaliit ang fracture, but I'm telling you, overkill. Kung fracture lang, na simple fracture, tapos inorderan mo ng bone scan or inorderan mo ng MRI. 'Di ba? Sobra naman yon. So the point is lang, kahit afford pa ng patient mo yon, you have to know when to order in a way or and when not to order kung kaya na. Okay? So what is the role of imaging in the diagnostic process? Ito yung napag-usapan namin ng laboratory professors nyo. No? Ang ganda ng pag-uusap namin. When do you recommend imaging? Okay, the most important aspect, let me read is using diagnostic imaging effectively in the primary care setting is making the appropriate judgment on whether diagnostic imaging is needed. Yan ang pinakauna. Why? Remember, we are in the Philippines and I tell you, maraming mga pasyente, okay, hindi pa rin sila makaka-afford. Hindi pa rin sila makaka-afford ng mga diagnostic imaging. So that's a very sad um, situation, no? In fact, no, minsan, though, gaya nga nasabi ko last time, afford naman nila. Lalo na ngayon, no, na may zero billing, we have PhilHealth, we have Lingab. Swerte tayo sa Davao City actually. Pero, in general, mga pasyente is walang pambayad yan. That's what you have to think about when you're considering what type of imaging ang kailangan. Okay? Now, so bago ka magsasabi no na kailangan mo ng imaging or bago ka magsasabi na, "Ma'am, sir, baka pwede magpa-X-ray kayo, no? Kung pwede naman, pa-X-ray muna kayo para sure." Now, you have to ask yourself, now, will the results of the imaging, yung resulta ba ng X-ray mo talagang may mababago ba siyang or may mako-contribute ba siya na bago? Like for example, will it actually change your treatment? Will it actually change the diagnosis? Mga ganun, no? So you have to think about that as well. Now, imaging modalities are often essential in the investigation of differentials, but it's not necessary in all cases. Kasi nga, anong sabi natin, di ba? Ang laboratory and imaging studies are supposed to only aid in diagnosis. Kasi primary pa rin ang pinaka-nauuna, no? Physical exam and the history. Physical exam and history. So, I hope you remember yung time namin, yung kwento ko last week, I think, na karoon kami ng patient na nag-present as na sa pneumonia pero on imaging or rather nag-present siya as pneumonia on imaging pero hindi naman pala. Okay? So depende pa rin. Now, what are factors affecting the value of an imaging study? Well, marami, no? Marami. Like for example, ano yung weakness niya? Like take for example ultrasonography. Sabihin na natin isa ito sa pinaka-operator dependent. Ibig sabihin yung effectiveness and efficacy. Efficacy is under laboratory conditions and effectiveness is in in the field, no, or in real life. Ito yung pinaka-operator dependent. So ibig sabihin nun isa lang. Kung gaano kagaling yung gumagamit nung ultrasound, ganon din kagaling yung effectiveness niya. Ibig sabihin kung baguhan yung operator, edi do not expect na maganda yung findings mo or at least yung interpretation ng images, di ba? So, depende talaga. That's where experience comes in. Now, how about MRI? Now, remember, meron tayong tatlong planes most likely. It's going to be the sagittal, you have the coronal, and the transverse planes. Okay? So, choosing the correct planes is very important kasi depende talaga. Like for example, look at the example here, the temporomandibular joint. Malala niyo yung conventional tomography natin na kahit ako, no, I thought it was a femur or at least the pelvic area. Pero yun pala, temporomandibular joint. So, depende talaga. Okay? So again, ultrasound is more of the skill and operator dependent. Kapag naman MRI, it's more of the plane. The plane na pinili mo. And kung dagdag ko na lang din, no, actually depende din sa contrast na ginamit mo kung gagamit ka ng contrast. Now, ito yung pinag-usapan namin maganda, no? Ano ang gagawin mo? Kunwari may pasyente ka, tapos nasa clinic ka, di ba? May papakita siya sa iyong resulta ng imaging study, let's say X-ray. Kunwari may nakita doong fracture daw. May fracture daw. Pero nung inassess mo naman, walang mga shortening or anything, walang pain on the site, you even use the tuning fork kung familiar kayo, no? Paano gumamit ng tuning fork if there's a fracture or not, kapag may pain. Pero pag-assess nyo na physical exam, wala. So ano pwede nyong gawin? 'Di ba? So dito sa situation na 'yon, pasok yung imaging was positive for abnormality pero wala pala. Okay? So tingnan natin. Now, pag nangyari ito, ano ibig sabihin nito? This is directly quoted from the book. Sinabi, clinicians should place no more or less weight on the imaging than on other aspects of the diagnostic process. Ibig sabihin, do not overestimate the value of one of the individual components of treatment. That's quite wordy, di ba? Ibig sabihin na nun ganito. Huwag masyadong mag-emphasize na, ay kasi sinabi ng imaging, doon tayo maniwala sa imaging. Huwag mo rin sasabihin na, ay wala naman sa imaging, so talagang ano yun, walang-wala yun. Or huwag mo naman sabihin na, imaging lang yan, ako pa rin magbuot. Ang importante lang is, evidence-based lang tayo. So, anong sabi natin? History and physical exam are important, pero pag kinontra ka ng imaging, huwag ka magpadikta sa imaging. Okay? Ikaw pa rin ang magbuot, ikaw man ang clinician, and that is why always nakalagay sa baba ng mga radiologic reports or radiology reports na please correlate clinically. Always yan, always yan. Kasi meron namang automated system, no? They can get all the histories there sa mga database. Now, anong gagawin nyo? Kapag negative for pathology, pero tingin mo meron. Ibig sabihin, ano ang pwede mong gawin kapag yung imaging sinabi walang fracture. Pero pag tinest mo naman, talagang may fracture. Like for example, tingin mo may carpal tunnel or may carpal tunnel tuloy, may carpal fracture pero negative yung x-ray mo. So ang pwede mong gawin is you can recommend another modality, maybe CT scan kung kaya niya, no? You can also check for another angle. Depende kasi yan, no? So anong series, no? Sa wrist ang kinuha or sa kamay. Or pwede din, no? Kung alam mo talagang walang-wala, tapos sure ka naman talaga na talagang may fracture siya, di gamutin mo na lang. Immobilize mo na lang, do some splinting o ano bang pwede mong gawin to minimize danger. And then, maybe after a few weeks, pwede mong pagawa ulit ng x-ray kung saan mas klaro na siya. So again, do not give more or too much or even too less of an emphasis sa imaging. So decide pa rin what you think is best for the patient. Hindi mo kailangan magmadali. Okay? Now, ito naman, what if imaging was positive for an abnormality pero di mo in-expect. Okay, ito, dagdag ko na to ha. That is called an incidental anomaly or an incidentaloma. That's like radiology speak for incidental finding. Like for example, no, anong usually nangyayari sa chest x-ray? Okay, usually magpapa-x-ray because of, let's say, an asthma complaint or let's say merong rib fracture kasi hirap huminga or may trauma. So, pero pag nakita mo sa X-ray, yung imaging, ang findings is meron palang we call it dumi, no? May nakitang dumi sa taas sa apices ng lungs. Ibig sabihin, most likely the patient has TB or had TB. Ano pa? Most likely, no, kapag mga smoker or or smoking lang, sasabihin niya na hirap siya huminga, ganon. Yun pala may pleural effusion na. Okay? So kapag mga ganung bagay, depende na yon. Okay? Kasi karamihan naman don't require intervention or at least acute intervention. Okay? Unless, of course, yung nagpa-x-ray lang ng chest tapos may nakita bigla na tumor. 'Di ba? Pwede yon. Pwedeng makakita ng tumor sa x-ray. Okay? Now, ang importante lang doon is pag may nakita ka, refer mo na lang. Okay? Refer mo na lang sa sinong dapat, either sa primary physician or sa oncologist or even the radiologist. You can always ask. Now, anong common findings nga according to the book, no? Yung PT usually may see reports of degenerative changes, lalo na pag sa katandaan, no? Ng low back pain or let's say iba yung reklamo niya, pero it turns out na meron na siyang osteoporosis or depende. So kapag mga ganito na common sa population, isipin mo na lang, is it going to help more sa complaint niya or hindi naman connected? Kung hindi naman ganun ka-connected, okay lang, hayaan mo muna. Okay? Pwede mong i-mention, like for example, magsasabi sa yung pasyente na, anong ibig sabihin yan, sir or doc, no? Yan talaga yung mga pasyente. Anong ibig sabihin yan? Pwede mo namang sabihin. Pero do not, again, wag nyo rin takutin yung pasyente. Okay? Wag nyo rin takutin. Sabihin nyo lang yun ng findings, tapos saan siya dapat magpo-focus. Okay? So, anong role of imaging and physical therapy intervention? Remember, sa radiologist pa rin ang may pinakasasagot, no, sa radiologic diagnosis. Okay? So, sila pa rin na magsasabi in the end. Sila ang may problema pag na may nagkamali. So, demonstrate the exact location, exactly nasan yung distribution according to the imaging, and even look at pertinent information for the surgeon. Like, what we do. For example, nag-spinal surgery yung pasyente, nilagyan ng nag-instrumentation, tinanggal yung disc, nilagyan ng bakal or titanium yung likod. So, pagkatapos nun, i-x-ray yung pasyente after maybe a day or two, paglabas ng ng anesthesia, ng anesthesia unit. So, ito check kung sakto ba yung placement ng bakal sa likod. Okay? So it's the radiologist who looks for that. Okay? Now, ang gagamitin kasi talaga ng physical therapist for imaging is it's not really for diagnosis, okay? But to check kung alin dito ang bagay at hindi bagay sa pasyente when it comes to actual therapy. So, ano pa, no? Information the therapist needs may not usually be evident, okay? Kasi pang physician nga talaga, 'di ba? At least for how it is now being written, it is physician to physician yung pag-uusap. That is why when you go to the hospital and when you actually read charts, makikita nyo na lang, no? Refer to surgery, refer to radiology, refer to pathology, refer to pedia, refer to IM or internal medicine. Hindi na nag-uusap-usap yung mga doktor. Usually sa chart na lang sila nag-uusap. Okay, minsan nga nag-aaway pa yan minsan. Nakakatuwa, no? Kasi for example, no, let me ask you, abdominal pain, kanino ba siya? Is it going to be pediatrics or IM? Depende kung sa edad, no? Or is it going to be surgery? Or emergency medicine? Alin ba doon? No? Lahat naman sila, kaya nilang gamutin yon. Okay? So, it also makes the ability to understand and derive data from imaging important. So, I'm gonna put this up later tonight on Gripper. So, eto lang yung differences, no, ng pinagkaiba ng physician as represented by radiologists using the imaging for medical diagnosis compared to physical therapist na for intervention planning ang gamit niya. So, let me just say one, no, identify and classify fractures. Tapos sa PT naman, practitioner, you assess bony alignment and check for any blocks to movement. So, all that. Okay. So incorporating imaging into treatment planning, how can the physical therapist take the wealth of information found in an image and actually use that in practice? Ito lang yun. So here's a scenario. So kayo, responsible nyo as therapist is to restore normal movement to an affected joint. Okay? Let's say sa shoulder. Kasi yun naman yung next topic natin, yung shoulder. So before choosing a treatment to address movement limitations, anong dapat mo malalaman? You're going to ask yourselves, no, regarding the shoulder or the shoulder joint, what barriers to movement might exist at the joint? Yun ang hahanapin mo sa x-ray. Okay? Malabo naman kasi pag ultrasound kasi you have to be there kasi in real time nga yung ultrasound unless naka-tape na siya or sa panahon ngayon, no, naka-CD or USB na lang siya. Okay? So, ang hahanapin mo doon is meron bang mga implant? surgical fixation? Naka-tape ba siya? Nakapako ba doon? Meron bang loose bodies? Meron bang excessive na scarring or may excessive ba na bony projections doon? Yan ang titingnan nyo kasi it's going to limit the movement or it's going to change the parameters na kaya ng pasyente for movement. Now, how about this? Which interventions or restoring movement are safe and appropriate at any given point in the patient's rehab? Okay, that's also one. Ano pa? How much stress applied to healing tissues will promote the return of normal function without causing harm? Okay? Alin yung saktong level ng range of movement na hindi mo malilimit tuloy yung healing nung, nung area or nung lesion? Where should the limb be stabilized to avoid movement at the fracture site? So can an adjacent joint be mobilized without endangering po yan, mali yan, endangering the fracture site? So those are things na you have to ask yourself. Yan ang magagamit nyo while in practice. Ito pa, no? How much weight bearing is safe at this time? Okay, baka naman mabigla. Okay? So hindi pwede na mabigla. And of course, ito yung napag-usapan natin, no, na I think that meron ito sa laboratory nyo. So I think you have an opportunity to use this soon, no? God willing, no, soon. So physical therapists incorporate imaging into yan, treatment sessions as a form of biofeedback. So it involves a physical therapist operating the ultrasound. So again, ultrasound, user dependent. So your experience will be important while simultaneously teaching a patient how to contract a muscle or muscle group. So, ganyan yung tsura niya. Okay? Pero look at the research. Okay? Ang sinasabi nito, characterizing muscle morphology in the presence of pathologies and after interventions to measure changes in the ability to contract muscles. So, dyan nila tinetest. Okay? So, again, in real time ito. Yun yung area of research ngayon. Okay? So, yung normal na movement, tapos i-check nila, i-compare nila kung ano yung differences pag may nakita silang pathologies or lesions. Okay?